This lecture will be on medication administration. So you're going to have to be able to list these objectives and be able to understand, demonstrate all the different things here. So be able to explain which each one of these things are, be able to identify the key terms. So what is your role when it comes to medication administration? So medication administration becomes the radiographer's responsibility during contrast procedures. So we draw up and inject the contrast media, and we also have patients ingest it. So it's your job to make sure that the medication is correct and we're doing the correct study, and that the patient is monitored throughout the whole procedure. So anti-anxiety drugs and medications are given to patients so that they can tolerate procedures. We normally will give a Xanax or something like that, but anesthetic drugs, typically we are not responsible for. Okay, so what we're going to do is we are going to check the history on the patient. We need to know if there's any history of allergies. We need to prepare the medication for administration. We have to verify the patient's ID to ensure that we're giving it to the correct patient. We're going to assist the physician if he's going to be or she be giving the medications for us. And it's our job to monitor the patient after the administration. So if the state regulations and hospital policies permit, we might also administer and chart the medication or contrast medium. And yes, as technologists, we inject contrast medium. So orders can be written, verbal, or standing. In California, we have to have written orders. We can't have verbal orders. It is not permitted in the state of California. Just so you know, it has to be a signed order. All right, so it used to be 5 rights of medication administration. It is actually 6 rights, so don't get that wrong. It's the right dose, the right dose of medication, the right medication that you're giving, the right patient you're giving it to, at the right time, the right route, with the right documentation. So the one thing that they've added was the documentation. So we went from 5 rights to 6 rights. All right, so dosage. Normal dosage is provided in the package insert. And if you've ever looked at one of those, it's this little teeny folded up thing. And when you undo it, it's like 4 feet by 4 feet. I'm exaggerating, but it's really big, really small font. The only time I look at the package insert is if I'm injecting for pediatrics, and it will give a recommended dose for pediatrics. Usually your site has set protocols on how much to give based on patient's weight or their BUN creatinine levels or their EGFR, which is the estimated glomerular filtration rate. Physicians are not required to prescribe the usual dose. If there's a dosage question, verify the accuracy with on the order before you give it to the patient or draw it up. So if I have a question, it's like, okay, this patient has compromised kidney function. We gave him half dose last time. Let me talk to the rad and see if we're going to do the same thing this time. All right, so there's different routes of administration. There's enteral, which is oral, rectal, and nasogastric. There's medication inhalation, so that would be like your albuterol for asthmatics, or in nuclear medicine, we'll have them inhale a radioisotope. There's topical route. There's sublingual or buccal, and that's under the tongue or in the cheek. And there's parenteral route, which is our IV. So enteral route, so oral, rectal, or through the nasal gastric tube. So oral, it's what we do our upper GIs or esophagograms, so they drink barium or they drink an iodinated material so that we can see the esophagus, stomach. Rectally, so we put a tip in the rectum and we fill it up with barium or iodine. That way the patient doesn't have to drink it, and it shows us the colon really well. There's nasogastric, so it's an alternative way to get the contrast into the stomach. And it's more reliable and we can control it better than a patient drinking. So medication inhalation, so provide therapy directly to the lungs or respiratory system, and it's usually used in nuclear medicine with a radioactive gas. Topical route may be used to provide local therapy, such as for creams or rashes. Transdermal patches provide therapy by adhering to the medication to the skin, which is eventually absorbed and is absorbed into the bloodstream. There's sublingual and buccal routes. So There's the typical route variation, so absorbed through the mucous tissues into the bloodstream. It bypasses the GI system, so it's a lot faster acting. Sublingual is under the tongue and buccal is inside the cheek. All right, parenteral routes. So used to deliver drugs that cause irritation to the GI system, cannot be absorbed by the GI tract, and need to be rapidly delivered. So several ways. There's intradermal, subcutaneous, intramuscular, intravenous, and intrathecal. So as you can see, your intramuscular, we're at 90 degrees here, and subcutaneous 45 and 90, so it's 45 to 90. And then intradermal, that's what your TB tests are, so right there. All right, parenteral injection procedure. So you're going to greet the patient. You're going to check the patient identification, explain the procedure. You're going to select the appropriate injection site. You're going to perform hand hygiene and put on gloves and cleanse the area with an alcohol wipe. Hold the skin taut with your non-dominant hand. Insert the needle at the correct angle and pull back slightly on the plunger once you're into the vein. If no blood is present, you are not going to inject the medication. So this is incorrect. So I caught this with another lecture that I did on this. If no blood is present, do not inject. You need to see a flash of blood before you inject, okay? So withdraw the needle after you're done and wipe the injection site with the cotton ball. So check to see the patient is comfortable. Remove your gloves and perform hand hygiene. Chart the medication and discard in the proper containers. So the needles and the syringes go in Sharps containers, just so you know. Okay, important tip. Read the medication label 3 times before administration. So when you're pulling it out of a locked cabinet, because all of our contrasts are considered medications, so they're locked up. So when you're selecting it from the container, while preparing the dose, and just before injection. So it's absolutely essential that you have the correct drug at the proper strength and that it has not expired, okay? Really, really important you look at it 3 times. So IV route provides the most immediate effect, used for delivering most emergency medications when an immediate response is critical. Also used to deliver nutrition and chemotherapy. Used to inject contrast media for examinations of the urinary tract and for some CT studies, and to provide sedation during invasive procedures and MRI. All right, so looking here, it talks about the different needle lengths in your book. It shows you the different needle lengths. Usually we use a 1 inch to 1.5 inch, just so you know. 1.5 is very common, and the gauge, we go anywhere from an 18 to a 22. So I like a 22. Personally, I can do a lot of my injections at a 22. So 18 to 20, those are pretty big bored needles. All right, so needleless systems. These things are pretty cool, these little blue adapters. If you haven't seen one, they're pretty cool. So what it is, it's a little spring loaded right here. And so you push that on to the IV line or onto your needle and you twist it, and it makes it a closed system, which is really, really nice. And it makes it to where there's no more needles. And then we have a needleless system with the syringe here. And sometimes we'll have blunt needles that go in and you just attach it and able to drop the medications without having a needle. So extravasation, so it's also called infiltration. So it's a leakage or injection of IV fluids outside the vessel, so it's outside the vein. Infiltration refers to diffusion of the fluids into the surrounding tissues. Extravasation is the presence of fluid outside the vessel. Ticky-tacky. So we use the 2 words interchangeably. Extravasation is very painful and it can be dangerous. So if we have more than like 10, 20 cc's, you're going to have to call plastic surgeons in, and they're going to have to do surgery to get that out. So the treatment is to apply cold packs to the site. And this is controversial also. So you'll see some texts use cold, some texts use warm. I do cold, then I do warm. Then I do cold, then I do warm. So the cold helps with the pain and the swelling, and the warm dilates the blood vessels to help reabsorb the contrast. So you'll hear 2 schools of thought. So your book says to use cold packs at the site. So an incident report must be filed on all extravasation cases. So discontinue an IV, of course, you're going to use gloves, you're going to use a sterile adhesive bandage, and cotton balls or gauzes. When you're taking it out, you're going to put gloves on, and when you pull the needle, it's actually a needleless system. This is a soft catheter. This is angiocath. So this is a soft catheter. It's just plastic, and we'll pull it out. We'll put pressure on the site. Really important that you put pressure on the site so that there's less bleeding. All right, monitoring IV fluids. To avoid problems, call in advance and inform the nurse of the lengthy procedure. Plug in the pump rather than relying on battery power because the batteries will go dead. Watch IV fluids and allow time for replacement before the IV fluids are run dry. Don't let them run dry. If an IV set runs out or if an alarm sounds, call the nurse service immediately and wait till the patient, and rather than waiting till the patient returns. All right. So the main thing here is monitoring the IVs, that the height of the bottle or bag of contrast should be 18 to 20 inches above the level of the vein. If the bag is lower, then blood will backflow into the catheter tube and it'll clot, so it can ruin your line. So you want to make sure that the bag is or bottle is 18 to 20 inches above the level of the vein. All right. So precautions for all injections. You are going to wear gloves, period, at all times. You're going to dispose of all syringes and needles into a puncture-proof container without recapping. We never recap needles. They go straight into the sharps container, which are red. Use safety design needles and needleless devices whenever you can, and always follow the established rules for aseptic technique and read the label 3 times before drawing up medication, after drawing it up, and before administering. All right, so label the syringe with the medication name strength, so the concentration of the medication is not going to be administered right away. So a lot of the times if I have contrast in my pocket, I'll tape the bottle to the syringe and I will write down the time and the date in which I drew it up. Okay, so I keep it on my person at all times. So check the ID before administering the contrast or the medium, and check for allergies before you actually administer it. Make sure they don't have any allergies to it, and monitor the patient carefully for any side effects or reactions that could be happening. So chart the medications. The radiographer who charts medication must use the exact procedure established by the institution. So route of entry made in proper section of the chart. So usually date, time of day, drug name, dosage, and route of administration, and you always have your name in there too. All right, entry must be signed. So contrast media are chart as medications, and you're going to put the contrast agent name, how much you gave, the date and time of administration, and you sign it. All right, so that is your PowerPoint on administration of drugs.